Hello everyone, my name is Sophia, and for those of you who don't know me, I am a nursing student. I will be graduating this December 2020 with my Bachelor's of Science in Nursing. So in today's video, I wanted to throw it back to my first semester of nursing school and talk about how I got an A in pharmacology. So pharmacology is a nursing course that you have to take your first semester usually, and this course kind of has a reputation of being really hard and challenging. And I do feel like that there are some ways that you can do well in this class, and I wanted to share these tips with you all today. So without further ado, let's begin. Okay, so let's first start off talking about what pharmacology is and some foundational knowledge about pharmacology. So pharmacology is a nursing course over drugs. In this course, you'll be learning about all different types of classes of drugs. And this is a really important class for nurses to take because as a nurse, you're going to be giving drugs all of the time, and medication administration is one of the most dangerous things that nurses do. So you have to know about why you're giving a medication and what to look out for after you have given that medication when you are working as a nurse. So in pharmacology, like I said, you will be learning about all different classes of drugs, from cardiac drugs to pain relievers and so many other classes of drugs. So in this course, you have to memorize a lot of drugs. This class is all really focused on memorization because of the numerous amount of meds that you will be responsible for knowing. So it's really important that you find the way that you memorize best. Find a method that works for you so that you're able to memorize all of these drugs. So some foundational knowledge that I think you need to know before you start pharmacology class is find out if you're going to be tested on the generic names of drugs or if you'll be tested on the trade names or both. I think in most nursing schools they just test you on the generic names, but I have seen a few nursing schools that do test you on both the brand and the generic names. So be sure to find out from your instructor which one you will be tested over. Another thing that I recommend you do before you start pharmacology class is take some time to study your different routes of medication administration. So know the differences between oral, topical, IV, IV push, IV bolus, and injections. So with your injections, be sure to know the difference between subcutaneous and intramuscular injections. Knowing the different routes of medication administration is really important because some drugs can only be given through a certain route. Also, some routes, such as IV push medications, are going to have some more side effects, so you probably need to be more aware of this, and your instructor will most likely try to test you on what you need to know if you are giving it through this route that is more dangerous. Now, for my school, they did not make us know any doses of medications, but definitely check with your instructor on whether you need to know doses because that could be really important to know. Alright, so next I will be talking about how I studied specifically for pharmacology and some different ways you can use to study for pharmacology. So the main way that I studied for pharmacology and to memorize all of these drugs was using flashcards. Now, I know some of you might not like flashcards, but I found that flashcards were really helpful because they were really good with getting repetition in to memorize, and it was really good in that I could take these flashcards anywhere to study. They're very easy to transport, and I felt that flashcards really combine a lot of different study methods. One is it's really good if you're a visual learner because you're constantly looking at these cards. It's also really good if you're an auditory learner because you can look at the front side of your card and then read out loud what would be on the back side, what you wrote on the back side. Another thing is that it's really good if you are like a writing style learner because as you are making your flashcards and writing them out, you're kind of getting a first pass of kind of memorizing and being familiar with that drug just by making your flashcards. And of course with flashcards you can get a lot of repetition because you are constantly flipping back and forth and shuffling through these cards. What I would do is I would take my instructor's PowerPoints, and for each drug I would make a separate flashcard. Whatever was written about that drug on the PowerPoint, I would then write down on a flashcard for that drug. So I would include things like the mechanism of that drug, what is the indication of that drug, why are we giving it, some common side effects of the drug, and some other nursing considerations of the drug. So I would put that on each flashcard. So how I would use my flashcards is I would create like a stack of flashcards for every single class of drug that was going to be on that test. And I would maybe have like, let's say 15 cards in a stack. And so what I would do is I would go about 5 cards at a time and memorize those drugs. So after I did those 5, I would move on to the next 5 and study them, and then the final 5 and study them. Then after I had studied all of those, I would go back and then learn all 15 again. And that's a really good way because you're breaking it down. Instead of having to go through all 15 flashcards, it's a really good idea to study it in chunks and then put it all together, if that makes sense. Now, some other study methods you could use for memorizing in pharmacology could be mind maps. I would create a mind map and then I would make connections to like the side effects of the drug. So maybe I listed the drug in the center and then I would branch out and talk about its side effects and like its indications. If you learn really well through writing things over and over again, maybe getting a dry erase board would be really helpful for you. Now, regardless of your study technique, I would say that it's really important to start studying early for pharmacology. Try not to wait till the last minute to try to memorize all of these drugs because that can get very overwhelming. And when you cram like that, you're going to have a harder time memorizing. And I was definitely guilty of cramming my first 2 tests in pharmacology. And later I learned the importance of really trying to study each day so that you're not so overwhelmed and your mind isn't so overwhelmed when it comes closer to taking the test. Okay, so now that we have talked about how to study for pharmacology, let's talk about what to study for pharmacology. So like I said, it's a good idea to use the information on your instructor's PowerPoints and then focus on that. But now, sometimes on your PowerPoints, your information is going to be pretty lengthy. Like maybe your professor will list a ton of side effects for each medication, and you're just like, how am I supposed to memorize all of these side effects? I know that I felt that way many times. And what I learned is you really want to focus on the side effects that would be the most detrimental to your patient. So for a lot of drugs, common side effects could be like nausea and vomiting and dizziness. You will see this for a lot of drugs. And you most likely won't be tested on those specific symptoms, but rather the more complicated and the ones that are more detrimental to your patient. Every drug kind of has one major side effect to it that is really important to know. So let's take your central nervous system depressants like your benzodiazepines. So since these are depressants, they can lower your respirations. They can cause respiratory depression. So this would probably be really important to know because if your patient's not breathing, that could be a huge issue. So you need to know the side effects of things like that. A lot of times the professor will include the mechanism of that drug. Sometimes these mechanisms can be very specific and that they talk about like receptors and like GABA receptors and stuff. And honestly, I don't think you need to get that detailed. Just kind of have like a general idea of how that drug works. Don't get too specific because you most likely won't be tested on that. I would say when you're starting off on what to study for your pharmacology test, I would say first understand what class you're studying about and what that class of medications does. So like, let's take your beta blockers. So your beta blockers are going to act on the heart and can lower your heart rate. So now that you have an understanding of that class of drugs, you can now focus on each individual drug in that system. So for your benzodiazepines, you could understand that these drugs can be used for maybe sedation or for anxiety, and then you can study the specific drugs under that category. So it's really important to have a good understanding of that class before you study each individual drug in that class. Another thing that would be really good to know for each drug would be some contraindications. So a lot of times you will get questions on your exams asking about what a patient shouldn't take with this drug or what you should teach your patient not to consume with this drug or which other meds they shouldn't take if they are on this drug. A lot of times nursing exams like to test on like grapefruit juice and its contraindications with certain drugs. A lot of times alcohol has many contraindications with drugs. So focus on what would be really important to tell your patient to avoid if they are on that drug. So nursing is a lot about assessing as well. So there are certain things that you need to assess before and after a patient takes a certain drug. So let's take a beta blocker like metoprolol. This is a drug that can lower a patient's heart rate and blood pressure. So it's really important that you measure a patient's blood pressure and heart rate before you get it. Because if it's too low, this drug could lower the blood pressure and heart rate even more, causing some bad effects on a patient. So it's always a good idea to know, are there certain things that I need to assess for this drug? Because most likely you will be tested on that. So again, there can be a lot of information for each drug that can be very overwhelming. But I would say try to focus on the ones that can cause major effects for a patient. There's a major effect for almost every single drug, and one main nursing consideration you should be aware of for every drug. Okay, so now let's talk about your pharmacology exam. So like I said, pharmacology is a lot of memorization. But in your test, you will probably have some application questions, and that they will give you a scenario about a patient and maybe something about a drug they took or what drug you should give them or what to watch out for on this drug. So it is important that you're able to apply that information to a certain nursing scenario. Another thing is that in a lot of pharmacology exams, you will have select all that apply questions, maybe for side effects of certain drugs. One thing I would say to help you on the test would be to do practice questions. Once you do practice questions over certain pharmacology drugs, you kind of have like a good idea on what they like to test on for each drug. So doing practice questions would be great for that. Okay, so finally, I just want to talk about some other tips that I have for you in pharmacology to help you kind of memorize and learn all of these drugs. One YouTube channel that I used a lot in pharmacology was the nursing.com's MedMaster podcast, and they have a lot of videos over some of the main drugs you'll be giving as a nurse, and they talk about the main nursing considerations for each drug. Now again, it is really hard to memorize all of these drugs. One way you can learn all of these drugs is by paying attention to the drugs that you are giving in clinicals. So what I recommend is that when you are in clinicals, I would suggest looking up what medications that patient is on and what medications they will be receiving when you administer them that shift, and know, why are they getting it? Why are they getting it for their condition? What are some main side effects of that drug? And maybe what are some good things that you need to maybe teach them about that drug? Then when you are in the patient's room and you are giving the medication, I suggest maybe telling them what that medication is for and one thing that they should maybe watch out for on that drug. You don't need to tell them a ton of things about that drug, but maybe just one important thing regarding that drug. And if you were able to teach a patient about why they were on a med, that really shows you have a good understanding of that drug. Also, many times a patient will refuse a certain drug that would be really important for them to take, simply because they don't know why they are on that drug. So if you were able to talk to the patient about why they were on this drug and what it will do for them, the greater the chance that they will end up taking that drug. And again, it helps you to learn about that drug and store that in your mind on what that drug is for. Some other tips that I have for you all is to pay attention to commercials about drugs when you're watching TV. So really watch these commercials about drugs. A lot of times these drug commercials tell you what that medication is for and some important things to know about that drug. So that's always good if you're able to make connections wherever you can, even if it's just on commercials on TV. Another thing you can do is if you're picking up a certain drug at a pharmacy, ask the pharmacist, is there something that I need to know about that drug? Because again, the more connections you're able to make, then the better you're able to learn all of these drugs. Alright, so I hope you guys found this video helpful. Leave me a comment down below if you have any other questions about pharmacology. I would love to answer your questions because pharmacology was and is still my favorite nursing class that I have ever taken. And if you have any other video ideas about nursing that you would like me to make a video on, leave me a comment down below and please subscribe. So I will talk to you all later in my next video. Bye.